Welcome to another episode of Neurodegeneration Awareness and Artificial Intelligence, where we delve into the fascinating intersection of technology and neuroscience. I'm your host, Sukant Khurana, and today we are joined by a stellar panel. My old friend, Professor Alfredo Gezzi. I can sing praises of him for very long. I'll just simply say he's a polymath, engineer, scientist, musician, and I know him from the first few days I landed in Texas. Absolutely a fan of this guy. I have with me a colleague who I've got to know recently, Professor Mallika. Then we have Dr. Kaniz, who was a professor in India and is now looking to move to Middle East. We have some young students who are doing stellar work. Sohit is an AI engineer, researcher who's also interested in biology. We have Kanak, who's a biologist. We have Sahil, Jidnyasa, who are AI researchers. Welcome, everyone.
Great to be here, diving into this cutting edge tools. Thank you, Dr. Fukant.
Thank you.
Hi, everyone. Thanks for having me. This is actually a transformative topic with, I believe, a real impact.
Thank you, Dr. Sukant. I'm really happy to hear and share ideas with this group.
Yeah. Thank you, Dr. Sukant. I'm very much excited to discuss about these innovations.
And I am also excited to be here and contribute to this conversation. Thank you.
Okay, so let's discuss adaptive learning platforms. Today, we are exploring how AI enhanced educational tools can revolutionize awareness and understanding of neurodegenerative diseases like Alzheimer's, Parkinson's, and ALS. Let's start with adaptive learning platforms. Professor Alfredo Gezzi, how do you how do these tools tailor education to individual needs?
Well, adaptive learning platforms are a pinnacle of personalized education, Dr. Fukant. They use AI to analyze user interactions like responses to quizzes, time spent on topics, preferred formats, and dynamically adjusting content pacing and complexity. This ensures information about neurodegenerative diseases is accessible and effective for a diverse audience, from clinicians to caregivers to the public, maximizing engagement and retention.
Well, that's a very powerful foundation. Could you also explain how these platforms work in practice?
Certainly, yeah, these platforms rely on machine learning algorithms that build real-time profiles of a learner's knowledge and preferences. For example, if a user struggles with terms like amyloid plaques in Alzheimer's, the system might simplify explanation or add visuals before advancing. Reinforcement learning refines the approaches that are used for the user to progress, ensuring that the content stays challenging but not overwhelming. It's like personal tutor for each user.
Well, that's really amazing. Thank you for this. Now, Professor Malika, let's discuss stakeholder benefits. Malika, how do these platforms benefit different stakeholders?
Sukant, they're actually versatile for healthcare professionals. Adaptive platforms deliver specialized training, like simulated cases of rare diseases or modules on newer therapies which have been launched. For patients and families, they provide scaffolded learning, which starts with the basics and moving to practical caregiving tips. And for the public, they all offer engaging, myth busting content through formats like having gamified quizzes or storytelling, thus making the complex science relatable and memorable to the layman.
That's very important and interesting. Sohit, how would you integrate all of this into broader systems for sustained impact?
Yeah, so these platforms could integrate with medical school curriculum like hospital patient portals or community health programs. By personalizing content, they boost engagement and retention. They also support lifelong learning by adapting to users' needs. Say, a caregiver learning advanced Alzheimer's care over time.
That's really interesting. Kanak, how could these platforms effectively reach the general public?
Yeah. So, for the public, interactive formats like short videos or quizzes tailored to someone's knowledge level may work the best. And imagine a teenager learning about Parkinson's through a game or a series that explains symptoms simply, then gradually introduces the prevention tips also. So the AI adjusts based on their answers and making learning stick.
That's really amazing. Now, Dr. Kanis, how do these platforms ensure inclusivity?
Yes, inclusivity is really important. These platforms promote inclusivity by integrating features such as multilingual support, audio narration, text-to-speech capability, which actually helps users with limited literacy, visual impairment, or say learning disabilities. Additionally, AI can customize content to align with different cultural contexts, like using familiar example or local languages, addressing the misconception and makes the learning more engaging and relatable to diverse populations.
Okay, that's a very important perspective of how sort of you can have these platforms which are inclusive. Now let's look at interactive knowledge bases. Sort of let's move on to not just the content accessibility, but how interactive can they be? So, Professor Alfredo Gezzi, how do these tools provide instant, reliable information access?
Well, interactive knowledge bases powered by AI chatbots and virtual assistants offer 24/7 access to accurate neurodegeneration information. Using natural language processing and curated medical databases, they can interpret queries and deliver precise, empathetic responses. Sentiment analysis can even connect distressed users to human support.
Well, that's really interesting. I have, now it's becoming routine, but we were doing a nuanced sentiment analysis on alcoholism in 2014 when it was cutting edge. There's a pile of unpublished work lying with me, but yeah, this brings both interesting ideas and memories of unpublished work. But so now, how do these tools benefit different groups?
Well, I think they're invaluable. Patients and caregivers get immediate answers to urgent questions. Healthcare providers can access updated research or guidelines. For the public, these bots dispel myths like Alzheimer's is inevitable or uh, other myths that people may have, and this prevents um, prevent, I guess, misinformation, and they promote prevention.
Yeah, true that. Kanak?
Yes, sir. So, I think in underserved areas, multilingual chatbots with text to speech features can reach people with low literacy and no internet. And designing them for basic phones makes them accessible in rural settings also. Like, imagine a farmer asking a chatbot about memory loss in their own language and getting clear answers.
Yeah,
Sohail?
yeah. I think they also could integrate with wearables. Like imagine a smartwatch detecting irregular gait and prompting a chatbot to ask about Parkinson's symptoms, then providing relevant educational content.
And
Okay, Dr. Kings.
yeah, and reliability is another a non-negotiable part. These tools ensure reliability by drawing from curated and expert-verified medical databases to ensure accuracy, as trust and accuracy are essential.
Okay, now let's explore the visualization AR VR part because these visualization technologies can be crucial. Malika, how do AR and VR make neurological processes visible?
So, AR and VR create immersive interactive experiences, and you can visualize brain changes caused by Alzheimer's in 3D, interact with the neural pathways, and explore also treatment mechanisms, thus making whatever was previously abstract tangible and emotionally engaging to people.
That's really good. Alfredo?
I think they use 3D modeling and real-time neuroimaging data. Users can interact with these simulations, for example, to see how medication affects plaque buildup. AI ensures accuracy, creating both educational and engaging tools.
And how do they benefit different users?
Well, research gain insights into disease mechanisms. Basically, patients and families demystify their conditions. The public can explore exhibits in museums or fair. These tools educate while inspiring advocacy.
Yeah, and they could also be a part of medical training, school modules, or family education apps. As hardware becomes affordable, even rural clinics could adopt them.
Yes, I think for youth, VR makes learning feel like gaming, and AR apps can overlay facts on brain models, like making education fun and memorable also.
Also, features like haptic feedback in VR can help user with visual impairment, while multilingual narration support diverse languages, and cloud-based platform ensure that these tools work on basic and affordable devices, reaching even low resource setting.
Okay, let's move on to some final thoughts. Alfredo, how do these tools combine to create inclusive education?
Well, I think they integrate accessibility features like cultural relevance and mobile-first design. From multilingual narration to AI-based personalization, they can make neuroscience education equitable and far-reaching.
And what about ethical concerns?
Well, that's a very important question. Privacy is crucial. Data must be encrypted and used with consent. Tools must remain affordable, scientifically accurate, and clearly supplemental to the professional advice.
I envision caregivers actually using chatbots, as we spoke earlier also, students learning through VR, and doctors training on simulations, which are all connected by AI. So, this network will eventually empower everyone, enhancing early diagnosis and empathy.
Yeah, and future tools might incorporate variables and genomics to tailor education even more. Social media could help amplify these efforts eventually.
Also, these tools humanize science. A family learning in their own language, or I guess a child understanding dementia through AR. That builds empathy and awareness also.
Exactly. Bridging knowledge with action is where uh, these tools shine.
Well, yeah, I think very well said, Kanis. Bridging knowledge with action is absolutely vital. Now, let's have some reflections from students. We have some AI researchers, students who have also joined us, who are basically from AI and starting to move into neuroscience. Sahil, what stood out for you?
Yeah, so learning about Parkinson's through a VR game sounded amazing. Also, knowing chatbots are available anytime in is really comforting.
Aditya?
I love that AI makes it easier to talk about these diseases. Like if your phone helps spot early symptoms, it becomes normal to check and share with your peers or your guardians.
I love the idea that AI adapts to your needs, whether you are a kid or a doctor. It makes tough topics easier and more engaging.
Well, thank you all for valuable insights, and thank you, listeners, for joining us in exploring how AI can transform neurodegeneration awareness. Stay curious, and we'll see you in the next episode. Bye bye.